Work. Yep, so we are now recording, and yeah, we lost our presenter, Deb Maruska, and that is okay. I have the slides, and we can go ahead and start going through them. I think that'll be just fine. And I don't know, I know Nicole is here. Nicole, do you want to go through the slides, or do you want me to start going through them?
Yep, I can go through the slides until Deb comes back on.
Until we get Deb back on. All right, Deb just had some technical difficulties. I'm going to go ahead and highlight you for now, or spotlight you for now. There we go. Okay, and then let me get our awesome slideshow up here. All right, can you see that okay?
Yep, perfect.
All right.
So sorry about the delay today. If Deb ends up coming back on, I'll have her take over the presentation. So my name's Nicole Scheiber. I also work at Department of Human Services in the Disability Services Division. Deborah Maruska was going to do the presentation today. She's the SNBC coordinator at DHS. And then Tabiso Rowan is also going to be presenting on a couple slides on how the hub can help. He is the Disability Hub MN Community Engagement Specialist. Next slide.
Second. Okay, there we go.
So our objectives today is to talk at a very high level about the annual health plan selection, AHPS for people on medical assistance, MA or Minnesota Care, to learn about the Special Needs BasicCare, SNBC Managed Care Program, to understand the Disability Hub N role in helping people to make an informed healthcare enrollment choice while considering their healthcare needs, and then also highlighting some online resources that are available.
Awesome. And Nicole, it looks like we have Deb back.
Wonderful.
So, yep, let me just double check. Deb, are you here? Is this the right Deb? Just take a minute. Deb, is this Deb Maruska that just signed on?
Yes, it is.
Okay, perfect. Here we go. All right.
I apologize.
Oh, yeah. I was just gonna say, no worries. We get the technical difficulties all the time. So,
well, I'm blessed. I have a wonderful person here who said, "Your computer just completely went off."
Yeah, no worries. I'm glad it all worked out. And can you see the slideshow here?
Yes, I can. Thank you.
Yeah, of course. So here, let me make sure we're on in the right spot. Online resources, and we were just kicking off right here, or continuing here.
Like, are you speaking?
No, you're okay. Welcome to take it away. Yep.
Okay. Well, thank you. Thank you for this opportunity to talk with you about Special Needs BasicCare. And you went through the objectives, I'm thinking.
Yes, this is the first slide. Yep, we went through this. We went through this first slide. Yep.
I want to make sure if I'm on the right page or not. Okay.
Here we go.
Each fall, Minnesota Healthcare Programs members who receive their healthcare coverage through a Medicaid managed care program have the chance to choose a new health plan for the coming year if more than one option is available. People enrolled in Special Needs BasicCare also receive an AHPS letter, annual health plan selection, and that provides them information about how to change health plans, enroll or disenroll from an SNBC health plan, or to opt out and return to fee-for-service, often known as straight MA.
Okay.
Excuse me, next. SNBC is a voluntary statewide medical assistance managed care program uniquely tailored for people with disabilities. With SNBC, you keep all the medical assistance fee-for-service benefits, and you may be eligible for more benefits. the health plan will pay for most of your health care needs. The total number of people enrolled in SNBC at this time is approximately 67,000. Who is eligible for SNBC? There are basically 3 eligibility criteria. First one is people must have a certified disability, either through the Social Security Administration or through the state medical review team. You should be between the ages of 18 and 64. You either do not have Medicare, but if you have Medicare, you need both parts, A and B. So next slide, please. Thank you. You know, why was SNBC developed is a question we get often here at the department. SNBC was developed because people with disabilities and advocates came to the department and said, people with disabilities need help accessing care. And so they said, we want to improve the care and access to primary, preventive, and behavioral health care. They told us that often when they went into a clinic, they saw them as just being a person with a disability and not needing all the primary and preventive care. So they wanted to also improve people's care with chronic conditions. They wanted to say that people with disabilities have personal health goals and need better health care. And they wanted to Medicare and Medicaid coordinated if they had Medicare. So we worked with the committee and we decided that one of the things they needed was a personal guide. And the health plans call this guide a care coordinator, care navigator, or a care guide. This person is usually a nurse, social worker, or behavioral health specialist, depending on the person's needs and desires. That is the reason we developed it and the purpose of it. There are basically 2 managed care program options. There's non-integrated and the integrated. First, we'll talk about the non-integrated, not the non-integrated SNBC option. And that is when people choose to enroll in this program only for their medical assistance, straight MA benefits they get through the health plan. And enrollment in this option in the non-integrated is about 55,000. People enrolled in the non-integrated SNBC, they basically I can have Medicare or no Medicare. If you choose to enroll this program in the non-integrated, which 24,000 people have, they are on Medicare, but they only want to receive their medical assistance benefits through the health plan. They receive their Medicare benefits, Part A, B, and D, through original Medicare. And that's a choice they have the right to make. However, the integration is an important aspect.
Deborah,
Yes.
This is Nicole. I'm going to just pause you. Can you go back one more slide, please? One more slide.
Go back one more from here.
Yep.
Gotcha. Okay, there we go. Gotcha.
Yep.
Mhm.
Thank you.
And that's because I talk so fast. We talked about this, the non-integrated part, SNBC option. And like I said, there's 55,000 people, and people enrolled in this program may or may not have Medicare. There are 24,000 people who are enrolled in Medicare and have chosen to enroll in the SNBC non-integrated side, which is fine. It's a choice they make. They receive their Medicare benefits, Part A and B, through original Medicare. Next slide, please. Thank you. Then there's the integrated managed care option. And this is where people enrolled in this program, integrated SNBC, sometimes referred to as ISNBC, have chosen to receive their Medicare Parts A, B, and D, and their Medicaid healthcare benefits through an SNBC plan. That is why it's called integrated, because it's Medicare and Medicaid all rolled into one plan. This integration of Medicare and Medicaid services makes enrollment simpler for the person, and they get easier access to benefits for people because they're only going through one plan. People requesting enrollment must have Part A and B when they enroll. We currently have about 11,500 people enrolled in that program. Moving to the next slide, thank you. We're going to talk a little bit about the SNBC on non-integrated enrollment, okay? So People who are newly eligible for medical assistance, newly eligible for MA, and have disability eligibility status are offered enrollment in SNBC non-integrated on a monthly basis. They receive a letter from DHS. And when they get the letter, they can do nothing and be enrolled in the SNBC health plan listed first on the form, or choose a health plan if there's more than one SNBC health plan available in their county. They can also opt out and remain in fee-for-service. These choices are important. So it's important when they get the mailing that they read the letter and they all the documents enclosed in the letter, and then they can call the Disability Hub too, so they can make an informed choice. During AHIP, which remember is an annual health plan selection, people in SNBC will receive a letter to remind them that in SNBC non-integrated, they can change the health plan, remain in the same plan, or disenroll and return to fee-for-service. And at any time, people can use the DHS choice form to enroll, or they can call the hub. And the information is on the slide, and I believe these wonderful people are putting things in the chat for you as well. For the next slide, we'll discuss integrated SNBC. As we move on to the next slide, people who are newly eligible for MA and have a disability eligibility type, they can enroll into integrated SNBC. However, in this program, they need to call the health plan for the enrollment form. They also need to talk with the health plan when they choose to disenroll it. People need to call the plan to request an enrollment form. And during annual health plan selection, people in integrated SNBC, these are so much mouthfuls, I apologize. That's why we make the acronyms like for SNBC. They can do nothing and remain, the annual health plan selection letter, they can do nothing and remain in their current integrated SNBC plan, or they can change plans. They can call the new health plan, integrated health plan, to request an enrollment form, or the person may decide to disenroll. They have to call the health plan to disenroll. When you're integrated, you have to call the health plan, request disenroll, and you can return to fee-for-service MA and get your medical assistance and your Medicare Part A, B, and D through original Medicare, and you can get your MA through fee-for-service. Or you can also choose to disenroll, call it the integrated health plan, and enroll in a non-integrated health plan and get your Medicare Part A and B and D through original Medicare. There's so many choices. That's why we are so fortunate to have the Disability Hub helping us. One thing I want you to understand, to really keep in mind, that if a person chooses to disenroll from an integrated health plan, they need to either contact the senior linkage line or go to Medicare.gov to choose a new Medicare Part D plan. We cannot stress the importance of this. Very important, because Medicare Part D pays for your prescription drugs, and you want to get in a plan that will pay for the medications you're currently on without having to do any transitioning. As we move on to the next slide, we're going to talk about enrollment in SNBC. Some of the things that people have brought forward to us when they enroll in SNBC is what will it change when they have these special services that are home and community based. You have no fear. If someone enrolls in SNBC, you will continue to receive your services as assessed for and authorized by the county for CADI, Community Access for Disability Inclusion, for CAC, Community Alternative Care, for the brain injury waiver and developmental disabilities, the county, and you will continue with your long-term care coordination services. Personal care assistance will continue to be authorized and paid for by fee-for-service. And in the future, when PCA turns community first services and supports, that too will be continued to be assessed by the county. And all these services will continue to be paid fee-for-service because SNBC concentrates on the health care part of it. of your service is in Medicaid. Moving to the next slide where we talk about the contracting. DHS currently contracts with 7 managed care organizations to offer SNBC healthcare coverage in 87 counties. In some counties, there is only 1 managed care organization providing SNBC, while in other counties, there are 2 or more. The 7 agencies we contract with are Hennepin Health, Health Partners, Medica, PrimeWest, South Country Health Alliance, UCare, and United Healthcare. Of the 7, they all offer non-integrated, the basic package. 5 of these health plans offer integrated SNBC. They are noted in this slide by the asterisk, which is Medica, PrimeWest, South Country Health Alliance, UCare, and United Healthcare. And remember, the integrated is combining the Medicare and Medicaid coverage. On the next slide, we were going to talk about the differences. There is a difference. People say, well, the healthcare benefit is the same in all the plans. That's absolutely true. But there are things that you need to look at because there are differences in networks. You need to look to see if you will have access to all your current providers. And you need to go farther than your providers, and you need to look at your specialists, your DME providers, but you also need to ask things such as are referrals needed for specialists, because some health plans have chosen to have referrals needed to go see some specialists or all specialists. Others are an open network. You can see whoever's in their network. These are the type of questions you would want to ask. And the health plans vary on the amount of care coordination, navigation, that personal guidance we talked about earlier. So you'll want to, if you're interested in that portion, you'll want to understand what their care coordination system is like. And they do have coverage of additional benefits, such as additional podiatry visits, membership to health clubs, vision upgrades. So you want to ask all those type of questions, or look on their work with the hub, or look on their website. In the next couple of slides, we're going to talk a little bit about the differences between fee-for-service and SNBC. Okay, providers. For fee-for-service, you can go to any provider that accepts MA fee-for-service payment. In integrated and non-integrated SNBC, you have to go see health plans providers, doctors and clinics that are in their network. That is why we say, look and ask what if your providers are in their network. There's a 21st line in non-integrated and integrated SNBC. The nurse line is there to call them with questions, and they'll refer you to the best place for care. There is no nurse line in fee-for-service. In regards to copays and deductibles, effective January 1, 2024, there are no deductibles or copays in fee-for-service. In non-integrated and integrated SNBC, there has never been copays or deductibles since the program's inception. But I am glad to say that now everybody will have no copays when they're on Medicaid. In regards to prescriptions, effective January 1, 2024, there will be no copays on medications that are paid for by MA in fee-for-service. However, everyone should keep in mind that if Medicare is the payer, there are copays on Medicare Part D prescription drugs. So that applies to the non-integrated. In the non-integrated program, there's no copays for Medicaid, medical assistance paid drugs, but if the person is on Medicare, they will be paying for the prescription drugs because copays apply. Now, in the integrated SNBC, and I stress this a little bit, this is one of the questions you'll want to ask for research, whatever, however you prefer to make your choices, is that copays on Medicare Part D do apply for some plans. There are some plans where there is no copay on Medicare paid prescription drugs. Please check with the health plans to see if there is a copay. And continuing with the differences between fee-for-service and SNBC on the next slide, we talk a little bit about care coordination. There is no care coordination in fee-for-service as a service per se, separate. In SNBC, both programs, non-integrated, integrated, there is a care coordination. That's special service. They wanted personal assistance that they were at for the department to arrange. And this is to help plan care, connect providers, and to increase coordination between providers, help assist you in educating you on any of the lab tests or results, etc. Extra benefits. There are no extra benefits in fee-for-service. The non-integrated SNBC may offer additional benefits. Please check that when you're reviewing for enrollment. In the integrated side, there are several different types of benefits. As we said before, there's health care membership, there's transportation to such things as Al-Anon, and depending on the plan, you'll have to check with that. Spend downs, if you have a medical spend down in fee for service, a provider will bill you for them. In SBC non-integrated, when you have a spend down. The healthcare cards, in fee for service, you have an MA Medicaid ID card. When you go to a provider, you have to show them the Medicaid ID card. And if you're on Medicare, you will have to show your Medicare card, and if it's prescription drugs, you have to show your Medicare and Medicaid and Part D. For SNBC non-integrated, remember that's Medicare's outside of SNBC member will show their SNBC health plan card. If they have Medicare, they will also show the Medicare card for Part A and B, because don't forget, some drugs are paid for by Part B, and Part D card for prescriptions. Now, when you're enrolled in the integrated SNBC, there is one member ID card to show providers because it covers all services and drugs for both medical assistance and Medicare. You do not have to enroll in a separate plan like you do in fee-for-service and in non-integrated SNBC. If you have Medicare, you enroll in a separate Part D plan. And some of my favorite people are going to present, I believe, on the hub. Yes.
Yeah, we are. Hi, this is Tabiso here. I'm just taking a second here. Let me put myself, let me add myself here so folks can see. Yeah, thanks so much, Deb. And I was just gonna say a little bit about the hub. So my name is Tabiso Rowan. I am one of the community engagement specialists with the hub. I was also an options counselor on the phones, helping people find resources and navigate things like SNBC for 5 years. And so just explaining a little bit, about the goal of the hub and so our goal of Disability Hub MN staff options counseling is for people to feel supported, right, through the process of making an informed healthcare enrollment choice while considering their healthcare needs. So there are so many different options, and we just look at the different options and have to, a lot of us. I'm a person with a disability as well. I use a wheelchair and things like that, and we have a lot of different things to consider in terms of our healthcare needs. So we are good at helping with that. One of the things we will do is explain what SNBC is and how it differs from fee for service, as Deb was explaining a bit about here today. We can review different healthcare coverage, the needs and preferences. So just looking at all the different options that are available through the different plans and what they offer in different benefits, and finding what fits a person best. And then also, discussing the SNBC health plan options available. So, depending on what county you're in and other factors come into play when qualifying for SNBC plans. And then we can also tell you where you can get more information and make an informed, informed choice. And within that, revealing the the SNBC health plan choices through the county, because as Deb said, different counties have different options. And then if a person is enrolled in Medicare, we will explain the differences between ISNBC and SNBC NI. As Deb was explaining, there's the integrated SNBC plans and the non-integrated SNBC plans. Yep, and let's see if it's going to work here. Okay. And then, yeah, a little bit more about that, assisting with SNBC NI enrollment. We can help with that. Disenrollment and opt-out requests, so we can actually help people enroll and disenroll directly in and out of their plans, or opt out. If they got enrolled, then they need to opt out, because if they got automatically enrolled and need to opt out, we can help do that as well. So people can give us a call. And I will put our information in the chat in a minute here with our phone number and things like that. So you can give us a call or chat with us online. And then also letting you know, we can complete the SNBC choice form on the person's behalf. So as I was just saying, we can complete the enrollment or the disenrollment or opt-out form on a person's behalf. And sorry, these slides keep automatically jumping. I'm not sure what's going on here. But in any case, we can also refer people to SNBC plans for the ISNBC, the integrated plans, enrollment or disenrollment. And then if a person says that they want to disenroll from the ISNBC, we can refer them to the senior linkage line or Medicare.gov to choose a Medicare Part D plan, which ties into the integrated plans as well because of medication coverage and things like that. So yeah, and like I said, I'll put our phone number in the chat in a minute here, and then we'll just continue.
Once the enrollment form is completed and sent back to DHS, the person will get a confirmation or denial letter coverage from DHS in the mail. And if you're enrolled into SNBC, you will receive a letter telling them when the health plan will start and when it will end, which plan you're enrolled in. The letter will tell you when the services will start. And after you receive that letter from DHS, the health plan that you're enrolled in will also send you a letter. And the letter will contain a member ID card, information on how to access the health plan's provider directory, the member handbook, and the formulary, which are a list of covered drugs. There are different and available resources to help you and when you're in your research to decide if you want to enroll in SNBC. There's a guide to SNBC enrollment, and thankfully from the advisory committee and from the hub staff, we have updated that guide and should be out soon. There's the managed care summary of coverage and other resources that you can use. And I just want to thank you for your patience, and especially with me with my technical difficulties, which it took a staff person to help me out. I appreciate it. Thank you for your patience and time.
Hi, Deb. We did have a couple questions come in. And I know we're running a little over time here, so if folks have to leave, that is okay. We are recording this session, and we'll make it available through Facebook and through our YouTube channel. And so someone had sent, and just want to remind people not to share any personal information if you have questions here. But someone was talking about their son will be 18 soon, and he'll need wisdom teeth out and braces. Will this all pay for that? Yeah.
Okay, that's a very good question. And while I encourage people to enroll in SNBC, I also encourage you to compare. And I would like to tell everybody that the legislature changed the enrollment benefit for fee-for-service as well. So I would encourage you, as of January 1, 2024, there is an expanded coverage and fee-for-service. So please compare that against the health plan coverage. And then and each health plan is a little bit different, and it may be covered under some. And it may be covered under fee-for-service as well. So more research is needed after January 1. Does that help at all? No. No? Okay. What would I could send the information to the Disability Hub staff and they could get it to you because it is in the member handbook, but I want you to be able to compare what's the change in fee for service, which is pretty large for January 1. Absolutely would like to see people enroll in SNBC, but please do research on both sides. So I can send it to someone there and they can get the changes. The changes, okay, the changes are in the, should be announced online on the DHS website. And I believe the manual has been updated and it's also in the SNBC handbook, which I can make available to the hub staff.
All right, yes, and yeah, you're welcome to give us a call. And then anytime if you have any further questions as well, we have a couple other questions here that came in a bit ago. Someone was asking about needing to be 18 to, I thought you had to be 18 to 64 to be on SNBC. It sounds like they're saying because, and then they say, do you need to be, don't you need to be 65 to qualify for Medicare?
Oh, hey, that's a very good question. No, some people do qualify for Medicare under the age of 64. As a matter of fact, 55% of people with disabilities have qualified for Medicare under the age of 65. And you can get more information on that, medicare.gov, and perhaps the hub. I know that they done a lot of education for me and my son. So
yes, definitely give us a call if you have any questions regarding the Medicare and how to qualify for SNBC or Medicare as well. And then I have another one saying if someone is currently, if they currently have Minnesota Care, should they change to SNBC and why?
if you have Minnesota Care, you're not on Medicaid medical assistance. But we do have people who qualify for medical assistance with a spend down, and they are not eligible for SNBC. But if your income changes and you get on medical assistance, people do change to SNBC often. Right now, we have about, I believe last figured out was 70% of people with disabilities are enrolled in SNBC, or is it 68%? Are enrolled with it. And why? They go for the additional benefits. They enroll because it's easier in dealing with Medicare paperwork, and they also enjoy the personal help that they get that the member gets because of the fact that they can understand lab tests. They become more educated on their own condition.
And then yeah, we had a lot of questions coming in there. And then I was going to get our phone number up here. Someone did ask what is QMB, which is a little I guess I could see how that relates. And they were wondering, is SNBC part of QMB?
No,
and,
you have to. Yeah.
Yes, yep, qualified Medicare beneficiary is for people with Medicare. So it's a different program.
Right.
Yep. Let's see. Yeah, I don't see any specific questions here. Let me grab our information real quick here. And yeah, if you have additional questions or want to go into deeper details or just figure some more things out, definitely give us a call back. And let me just make sure I'm sending this to everyone in the meeting here. Lots of technical stuff going on today. Okay. So here I just posted in the chat, I posted our phone number and then a link where you can chat with us online. So you can just click the link and then you don't have to necessarily call someone on the phone. You can chat and we can answer questions, show you options. And then, yeah, I'll put my name in the chat. So if anybody has any questions, they can, my extension is, let's see, 66. So if anybody has any questions, they can give us a call. They can ask for me. I'll be in touch with Deb as well, so we can get any information that people are looking for. So you can call the hub. You can ask for my name. It's Tabiso. yeah, and we can definitely just keep in touch. So once again, like I said, if anybody has any additional questions, go ahead and give us a call at 1-866-333-2466. And yeah, thank you so much, Deb. And once again, we will have this recording. We're going to put it on our Facebook page. And if you are looking for information or trying to get a hold of us, that's another way you can go to our Facebook page, and then you can see stuff that we're posting, and you can message us. We don't answer specific questions through messaging through Facebook Messenger because it's not secure, but you can at least reach out to us if you have further questions, and then we can stay in touch that way. So just wanted to let you guys know the different ways you can keep in touch with us at the hub here. And yeah, once again, thank you for joining us, and I hope everyone has a good rest of their day and then also a great weekend. And Deb, thank you so much once again.
Thank you.
Yep. Oh, and I'm sorry, Deb. I have one person here who just raised their hand. It was Natalie. Natalie?
Yes, I'm in the chat as well. I'm wondering if the PowerPoint slides are gonna be emailed to me because I need to see them, and my mom is with me too. She needs to see them as well too.
Sure. That would be okay. Natalie, can you access the chat right now? Can you see the chats?
Yes.
Okay, let me put my email in there. You can just
Okay.
email me.
Perfect.
Yep, and we can just stay in touch that way.
To be so,
Yes.
I think we have to send that through accessibility check.
Which one?
PowerPoint. The PowerPoint.
Oh, yeah, yes, yeah. Well, yes. Well, I'll
I
have
apologize.
to.
I didn't get that done.
Yeah, we won't have it. We won't have it on our Facebook page. But you can, Natalie, I'm putting my email here. So it's tobesoR@mcil-mn.org. And then anyone,
Okay.
please feel free to email me, and we can see about getting you the PowerPoint or whatever additional information you're looking for.
All right, perfect. Thank you so much.
Yeah, of course. Yeah, happy to help.
Mhm.
Yep. All right. And do we have any other questions? Anybody still here? Nope, it looks like we're good. So once again, thank you, everyone. Thanks, Deb, so much. And everyone have a great rest of your day and a great weekend.
Thank you.
Yep. Bye.